and this is Michigan Health Star. I am your host. Today I have with me Dr. Daniel Judge from Dynamic Life Chiropractic. Dr. Judge has been a good friend of mine. I really like his approach, and I actually talked with him this year about some things that were going on. Last year there was a young lady, I believe a Playboy model, that was injured after a chiropractic adjustment. I believe she had a stroke.
Right.
I also had some issues with my son and some injuries regarding kind of like renegade chiropractors, for lack of a better term. Can you tell us, Dr. Judge?
We're a rebel group.
Yeah. Well, one thing too is there's a lot of different types of chiropractic. So I was hoping today you would be able to tell us about your progressive approach and what makes your particular, I believe you specialize in upper cervical.
Yes. Thank you.
So why don't you tell us about it?
When it gets down to approaches, there are approaches that are gentler and firmer, and depending on the case, one may be more applicable than the other. What I do is a very specific and precise, gentle approach with the intention of being safer for the patient.
Okay. So I think a lot of people, when they think of chiropractic care, I mean, I don't know about you, but a lot of people think about the old Jacob's Ladder movie with the chiropractor that was sort of this...
I don't know how many people saw that movie, but yeah, it's got some trippy, kind of freaky chiropractors.
Yeah, the chiropractor was like this, sort of like the therapist slash... but that's kind of gone away. I mean, there are those types of chiropractors. I know the ones that injured my son both had that aggressive approach, and I know enough about from being in natural health for so many years, and I believe in chiropractic care, that approach is kind of, I mean, is it going away, or it's still considered, I mean, how is that considered, those real aggressive chiropractors that just, you know, crack and whack or whatever?
Yeah, I mean, there's a type of treatment that's called diversified adjusting, is one of the more common approaches, which is what a lot of people think of as the twisting and cracking. I lean towards, and I think a lot of the profession is really starting to lean towards approaches that have less room for error. It's the old doctor adage, first do no harm.
Right, and that's so important that all doctors follow that. You were saying earlier, I know I talked to you before the show, you were talking about this woman that had this stroke after the chiropractic adjustment, and you had some really, I thought, important things to say about that. You were talking about there was some research.
Yeah.
What was that research?
Or what the research is really clear about. The biggest study that was done was by a guy named David Cassidy from Ontario.
When you say David Cassidy, I think of that heartthrob 1970s David Cassidy, but go on.
Right.
It's not him, right?
Not him, I don't think. I haven't met him in person, so maybe he had a second career. But he studied patients from 1993 to 2002 who had been admitted to the hospital for stroke, and he went back and looked at what was their history, and he was really trying to find out, is there an increased risk of stroke or increased incidence of stroke? Do more people who have seen the chiropractor have stroke? He looked at not only chiropractic patients, but patients who went to primary care doctor, and he found the same incidence was happening, where people would go to the doctor's office with severe neck pain and headaches, and then 2 or 3 days or a week later they would have a stroke.
Wow, okay. Yeah, so it's not exactly... It was going to happen at one point.
It was going to happen anyway, and what basically, when you have an artery that's tearing, people have injuries like they fall or they hurt their neck, and that can tear an artery in the neck, and it doesn't cause a stroke immediately, but the tearing starts to clot, and the tear also causes a severe pain. So people will often come in complaining of the worst neck pain and the worst headache they've ever had. And they go either to the chiropractor or they go to the MD. And the problem is really misdiagnosed. In both cases, they didn't do a thorough enough history to find out they had an injury recently and this could be a stroke in process, and send them to the hospital. It's more misdiagnosis than the chiropractor causing the problem.
Well, I think I told you with my own son, we were at a Christmas party a couple years ago, and we had a birth injury, and he had a very rough chiropractic adjustment when he was around 2, which his atlas, they said, was out. He had this blinking problem. His atlas was adjusted. The blinking problem did go away, but it was such a hard adjustment where the chiropractor actually chased him and then slammed his head so hard. It caused more damage because of the birth injury. And then later, a couple years ago, we were at a Christmas party. A chiropractor noticed probably my son, who does suffer from discomfort, just came up to him, was kind of putting people up against the wall doing this chiropractic thing, and ended up injuring my son. And I know that's what I like so much about your approach. And another thing that I really like about your approach is, I mean, that's what you do. This is what you do. You don't load people up with a bunch of other things. This is your craft. This is what you studied for. You're very respected in your field for that. I think a lot of us, when we go to the chiropractor, a lot of times chiropractors, you can get even into like MLMs, which is disappointing.
That's such a disappointment to me.
It is disappointing because you're like, God, you're good at this, or and then it just puts a damper on. It makes things very uncomfortable.
It's so unprofessional, in my opinion, to be doing adjustments at a Christmas party. And I don't know who that was, and so I apologize for the offense there, but I think we need to take it seriously. Like, it's not a party trick to adjust someone. It's anything that can help someone can also has potential harm, and so you have to really be serious. And I would say never, in my opinion, and you'll get different opinions, but in my opinion, there's enough variances in people's anatomy. You never want to start treating someone without a really thorough exam and understanding and imaging. I never adjust a neck without imaging of some kind, either X-ray, MRI, CT scan, because there's enough congenital abnormalities and differences, and people are just built crooked, right? We're built uneven, or we grow and develop uneven, not to a large extent, but function follows form. So the shape of your joints, the shape of your body affects how they move. And if you really want to help someone be stable, you need to not just move them, you need to help their body to regain neutral positioning, which is more about the brain than it is about pushing things around. And you can crack a lot of spines. We can all crack our own backs. You can flex back and crack your back. You can go side to side and crack your neck. But that doesn't change how the brain postures itself. The brain has the ability to move all these joints on its own. So what you need to do as a doctor is to help understand where is the system going wrong, and how can you help restore organization and order to the brain's own control of the body, and really empower that person to understand their own spine. The better they understand it, the more they can take good care of themselves.
I think that's a great point. Actually, I'm glad that he touched on this, because those of us who are in the natural community tend to shun X-rays, and obviously there are too many X-rays going on all the time. Everywhere we go, there's some type of X-ray wave going at us. But in this case, we can see how important it is to get some of those X-rays. I don't know how often. I mean, I've had a few chiropractors when I was little. One was giving me once a month X-rays for a year.
You just need
I couldn't believe my mom okayed that, but yeah, get the X-rays.
One set of X-rays.
One set of X-rays so they can see what's going on. Find a good chiropractor, someone who's a chiropractor, and someone who is into some of these more progressive techniques, because it has come a long way. And I think chiropractic's almost 100 years old now, really.
Yeah, well, over that. Okay. 1895.
Wow, okay, and this is Dr. Judge. If you want to see him, he's over at Adams Square on Adams and Lincoln, right? North of Lincoln?
Yeah, it's Adams, north of Lincoln, 725 South Adams.
Yeah, a little wellness community over there. All right, thank you so much for coming.
Thank you so much
for having me. Honor to have you on the show.
It's really a pleasure. Thank you,
you.
Aurora.
Bye. And we'll see you next week.